Hello everyone, I am Dr. Amy Hunt with the Cal Health Center, and I'm here to give you an overview of the Cal Health Cooperative Agreement instructions and training. I will be covering the Cattle Health Goals section within the Grants and Agreement Guide, go over the guidelines, and give an update to our reporting requirements. Please note that the animal disease traceability activities are covered in a separate presentation and section of the guide. The cattle health surveillance and outreach goals haven't changed much since last fiscal year. It's still important to conduct surveillance in domestic cattle and bison and targeted high-risk wildlife populations in order to maintain national, state, and herd disease status certifications as described in the regulations, standards, and surveillance plans. It's also important to respond to identified outbreaks in cattle and bison and provide outreach efforts to complement the program activities. For specific program guidelines around brucellosis, there are separate guidelines for Idaho, Montana, and Wyoming around the greater Yellowstone area. We have brucellosis management plans in those states that cover surveillance activities, including implementing risk-based management plans to mitigate risks associated with wildlife, holding at least one meeting between state livestock officials and wildlife officials, encouraging abortion screening in cattle, conducting epidemiologic investigations and other program activities as appropriate, and providing education to state, tribal, and federal VMOs, AHTs, AICs, and other appropriate animal health officials. For states outside of the greater Yellowstone area, we will expect them to provide education to state, tribal, and federal VMOs, AHTs, AICs, and other appropriate animal health officials. Also encourage abortion screening in cattle, and support the brucellosis epidemiologic investigations as necessary. For BSE, in all states, we expect them to collect samples to achieve state-level goals defined in the BSE National Sampling Plan. Collection should represent the clinical suspects over 12 months of age, emergency slaughter, and fallen stock. We also expect them to conduct outreach and education with accredited veterinarians and producers to encourage sample submissions in support of the national surveillance goals and sample collection targets, and conduct outreach and education with public health officials and public health laboratory directors about forwarding rabies negative submissions from cattle to the NBSL for BSE surveillance. For program activities regarding cow fever tick in Texas, we expect them to conduct targeted surveillance inside the permanent quarantine zone, coordinate wildlife hunting surveillance with local, state, and federal entities, provide tick submission program data and surveillance disease testing, continue collaborating with Mexico, as well as collaborate with TPW on white-tailed deer census and fever tick surveillance, as well as collaborating with APHIS-ARS on joint fever tick research. For tuberculosis program activities in all states, we expect them to visit state-inspected slaughter establishments to validate slaughter inspection, conduct outreach training and education with accredited veterinarians to ensure compliance with existing performance standards, implement a system to monitor the CFT response rates, conduct epidemiologic investigations as appropriate, and provide travel funds to cover the travel costs for state VMOs CCT training. For states with a bovine tuberculosis detection, we expect them to conduct targeted surveillance in geographic areas where TB has been identified, implement herd plans and management strategies, implement statewide risk-based management, and conduct wildlife surveillance to determine if TB is present in wildlife. For our other program activities, including the blood and tissue collection, we expect states to assist VS in bringing slaughter plants and all rendering plants into compliance with the BTC rule or in conducting quarterly inspections. For preparedness and response activities, we expect states to prepare, maintain, and exercise state-level plans, investigate, control, and eliminate emerging endemic zoonotic and FADs, implement risk-based management plans to mitigate risks. As an update for our reporting and data entry, we expect states to complete applicable monthly NLRAD NARS reports, complete data entry into our VS systems as appropriate, including EMERS, SCS, or the state Core 1, NBSL LIMS, and VSLS. We also expect states to supply surveillance and outreach data to the ABIC for those program activities that the area office does not have available on a quarterly basis. This data will be entered into DIS, and quarterly reporting allows ongoing availability of information compared to the previous annual request that was an 11-month period in September. Data submitting through surveillance and activity reports may be used to inform decisions about future agreement funding levels. And that concludes this presentation. If you have any questions or comments regarding it, please direct them to this email address or to your ABIC. Thanks for joining us today.